Welcome to Perimenopause Hell. This video is about the topic of atrophy, or as it's sometimes called, genitourinary syndrome of menopause. This is the number one most important topic to know about in this particular group because 50% of women actually suffer from this. And I know it isn't really a very pleasant prospect to think of everything down below shriveling and shrinking, but this is basically what happens. So let's go into some of the symptoms that you might notice. Now, if we look at this slide, this is what most women think of when they consider vaginal atrophy. They consider the atrophy just affects their vagina and it makes the vagina dry and itchy or painful during intercourse. But unfortunately, that is not the extent of it all. And in fact, the symptoms that you might first notice are nothing to do with your vagina at all. Now, atrophy is caused by low estrogen levels, which of course is something that happens increasingly during perimenopause. Your estrogen levels become lower and lower until your ovaries stop making much estrogen at all, and you go into menopause and your periods stop altogether. And that's the time when your estrogen level becomes permanently low. But you might notice symptoms of atrophy before that. So let's have a look what the most common symptoms are. You might notice that you suddenly go through a phase of having urinary tract infections, and you might also feel like you have a urinary tract infection, but actually when you send a sample to the doctors, there's no bacteria in it at all. You might feel a burning pain when you pee. You might suffer from urgency, so feeling like you want to urinate right away. And you might experience some incontinence, whether that's a little leaking or a sudden gush. You may experience irritation, so your bladder feels irritated. You may even see blood in your urine, which is the medical name for this is hematuria. And your doctor may be sending off samples or may send you for cytoscopy to check the inside of your bladder. But this is because a lot of doctors don't know about the urinary side of atrophy. So they completely forget that actually in women of our age, these urinary symptoms are actually down to lowering levels of estrogen and not anything to do with infections. And as I've said, even if there is actually an infection and the bacteria within that sample can be isolated, it may be that the estrogen is making your urethra, which is your pee hole, it's in a poor state, and so it allows more bacteria and germs to get into the bladder. So that actually causes the urinary tract infections. Now, the other symptoms that you can get are pain during sex because your vagina becomes very dry, loss of sexual sensation because the atrophy can actually also affect the sensitivity of the clitoris too. There may be tightening of the entrance to the vagina, which doctors call the introitus, and closure of the os. The os is the little hole in the cervix that allows the sperm to get into your uterus when you're conceiving. But of course, because in menopause, your body's shutting down its reproductive functions, you don't need to allow the semen into your uterus anymore. So the low estrogen actually brings with it the closure of the hole in the cervix, which is something to bear in mind if you're going for hysteroscopy after your menopause. You may find that the doctor can't actually get the hysteroscope into your cervix at all. So if we look at a picture of the normal female anatomy, if you think this entire area is really affected by the lowered levels of estrogen, that estrogen brought an increased blood flow into all of the tissues in that area. So you can see that the areas that are affected are not just the vagina. The vagina is in fact very close to the urethra or pee hole where your urine comes out of your body. So all that lovely estrogen has in fact been keeping all this flesh inside of your vagina nice and plump and healthy. And when those estrogen levels decline, even the rugae, which are the ribbed bits in the walls of your vagina, start to flatten and the vagina dries out. But you can see that the front wall of the vagina is actually the same flesh as the back wall of your urethra. And so the atrophy can also affect your urinary system and your bladder. So the loss of plumpness and healthy tissue in the vagina can also be experienced in the urinary system too. So it's not just about keeping your vagina moist, but if you treat the dryness in your vagina, it will have a knock-on effect on your urinary health. This is really important to realize. And also, of course, this has a knock-on effect on your clitoris and your vulva, which means that if you don't treat your atrophy, your sexual sensitivity can be reduced. Your vulva will become slightly less pink in colour. Your labia might start to shrink. So you'll notice everything on the outside starts to look less pink, more of a grey colour, and starts to become a little bit smaller. So really, there are a hell of a lot of reasons to treat your atrophy, not least because the incontinence is often a major factor in this, and it's why old ladies always used to smell of wee. But hopefully these days with our education and you listening to videos like this, you'll be able to understand, treat your atrophy before it becomes irreversible, and avoid so many of these problems that women always used to suffer with. Just to go back over some of the symptoms that we can suffer, the usual ones that doctors will ask you about are dryness in your vagina. You can develop a burning pain in your vagina. You can experience discharge. Often women will say in the group, "Oh, I don't suffer from this yet," and they may only get the urinary symptoms before or during their period because estrogen is lower then. But it's the beginning of the very same thing, you see. You may notice that your vaginal discharge becomes a bit strange. So a lot of women experience what's called leukorrhea, which is a prolific but rather thin vaginal discharge. That it isn't a result of any infection, but it's the normal vaginal discharge, the lubrication that your body produces, but it's much thinner than usual. So this is also caused by changes in the hormone levels, and you'll notice that that thin discharge that you produce is not very good at lubricating you for sex and so on. So you still might suffer from burning and dryness and itching, even though you are not particularly dry. So it says here also the itching. Itching may be inside and it may also be external, so around the outside parts of your genitals. So we're talking about the vulva, which is the clitoris and the lips and all those outside parts of your genitals. Urgency with urination, more urinary tract infections, urinary incontinence, bleeding after intercourse. Now, this often gets mixed up with spotting. A lot of women start to spot, and that's usually related to fibroids, polyps, and hyperplasia of the endometrial lining. But in this case, it will be because the condition of the vagina it's not so plump and healthy and lubricated as it was. So during sex, it starts to tear and bleed. So bleeding after intercourse can be due to atrophy, or it can be due to actually bleeding a bit of menstrual blood. So this is why we always say to get checked out if you're bleeding after sex, because it could be from inside of the vagina, or it could be a little bit of menstrual blood. Working out the difference, of course, is the key to treating it. Painful sex, decreased vaginal lubrication during sex, tightening of the vaginal canal, unable to have sex at all. This is why they say use it or lose it, really, because if you continue to have sex, you're unlikely to develop the symptoms in this respect where the vagina itself tightens, and it's usually the opening to the vagina, which I've mentioned is called the introitus, that tightens up. So when you're talking to your doctor about these symptoms, one useful thing to know is the difference between the inside and the outside of the vagina. The doctors will be calling the outside of it the vulva. So you can stop the video and learn all the different words here for it. The clitoris, the urethra, the labia minora and majora. The inner lips sometimes become very small when you're suffering from atrophy, and that's normal. One of the things that you will notice as you become older is that you become more susceptible to infections like bacterial vaginosis and yeast because the pH, which is the acidity and alkalinity of your vagina, starts to change and become abnormal. There are lots of products that you can use to keep your vagina healthy, and we'll go into some of those later on. One of the things I wanted to draw to your attention, a lot of women come to the group and they're saying, I can't seem to reach orgasm like I used to these days, or it's my clitoris is not as sensitive as it used to be, and this is a bit strange and worrying to them. And they may not even have noticed that their vaginal secretions have changed or their vagina is dry. They may not even have had any urinary symptoms, but they have noticed that they can't climax anymore, or it's more difficult, or that the quality of their orgasms is not what it used to be, which is all very frustrating, of course. So this is a diagram that actually shows the entire clitoris. And of course, most of us know this part here, which is the visible part of the clitoris. But the rest of it is actually, it's huge, but you don't see it, of course. But when you're considering the effect of the atrophy and low estrogen levels upon that general area of your body, when you see this picture, you then, of course, realize that this is really going to have an effect on your clitoris. So this is yet another reason to treat your atrophy. And as I've already said, after a couple of years, these changes can become permanent. So really, you don't want everything down there to wither up and die. You want to keep healthy so that you can have some kind of sexual existence after menopause. So let's just go through the treatments. And I have screenshotted a bit from our files here so that I can read it out, not forget anything, because my memory is not as good as it used to be either, ladies. So, right, the treatment for atrophy is really quite simple. Number one, Replens or a similar vaginal moisturizer. You can buy these from the shops. In fact, you can buy them more or less at your local newsagent these days. You can get Replens absolutely everywhere. This is not the same as lube or lubrication, KY jelly, and all that stuff. Lube is for using during sex. It is not a vaginal moisturizer. A vaginal moisturizer is for the skin in your vagina. You need to use it twice a week. It plumps up all the flesh in there and also helps your bladder, urethra, and clitoris, as I've already said. One of the things you need to do is make sure you use it at night. Do not use it in the morning and get up and go about your business, because gravity is not your friend in this respect. What it will do then is it will just drip out while you're walking around, and you'll need to wear a pad and so on. Use it at night, lie down, and it will soak into the walls of the vagina. There aren't any hormones in Replens or similar products. The title of this product is called a Vaginal Moisturizer, so you can go into any pharmacy and ask for Replens or a similar product. There is a vaginal moisturizer called Yes VM, which uses all organic ingredients. And in America, there is the option to get suppositories compounded. You may also call these vaginal inserts or vaginal creams. And you can have allergy testing to tell you which ingredients to avoid. One lady in the group actually had some compounded, and they were a mixture of hyaluronic acid and vitamin E. So even if you are very allergic to ingredients, there's always the option to get something or other made specially for you. We don't have compounding pharmacies anymore in the UK, which is a bit of a drawback for us British ladies, but Replens and organic products like Yes VM are available. The other option is a low-dose cream or pessary that contains some estrogen. Examples of this are Estrus or Vagifem. This is usually a prescription item. It is not, technically speaking, HRT or hormone replacement therapy. The levels of estrogen in these creams are very low, just enough to help all the tissues in that area. Once again, use it at night so it can soak in while you're lying down. Estrus can be expensive as prescription items go, so many doctors can prescribe a similar generic product that's a lot cheaper. Vagifem is actually a suppository, as Americans call them. We call those pessaries in the UK. So it's like a little tablet that you actually put into your vagina and it melts down. But it has a very similar effect. But Vagifem's usually a little bit cheaper than the other options. Sometimes doctors may prescribe something called Premarin, which again is an estrogen cream, but it's made from the urine of pregnant mares. So there are considerations there in terms of animal welfare, which mean you may decide not to use it again and ask for something called estrus instead. Estrus is the plant-based version. So what I would say is if the doctor's already prescribed Premarin for you, for goodness sake, use it until it's finished. Don't tell anybody if you're embarrassed and ask for something different the next time. It's too expensive, really, to waste these things. Don't feel bad, you weren't to know. So, the other thing to say about this is HRT and supplements which boost estrogen, they might help with your atrophy, but sometimes they don't, and you end up having to use one of these two types of products in addition to your HRT. For some reasons, HRT does not always reach the parts that it should, and it helps with night sweats and various other things that you'll find in our video about HRT. It doesn't always help with atrophy, which is a shame, but that's the truth. This is what Replens looks like in your stores, and it comes with an applicator that you fill up and then insert that into your vagina, press the plunger, and then it's all out. So you can do that while you're lying down. You don't have to get up after that. This is an estrus type of product. So it should say on the label, estradiol vaginal cream. And as you can see, it's 0.1 milligrams estradiol or estrogen. So it's not a very strong product at all. For women who are concerned about using estrogen creams because they have been told that they are HRT and they can cause cancer, I'm just going to read out to you an excerpt from a book called The M Word by an Australian GP called Dr. Ginny Mansberg. Vaginal estrogen, creams and tablets, and the 90-day rings, which are hardly used, containing low-dose estrogen, can be inserted directly into the vagina, or in the case of the cream, rubbed directly onto the vulva. If I can just stop here, actually, if you have clitoral atrophy, you can actually put some of this cream directly onto the vulva, as Dr. Mansberg says. That's a great advantage of using these creams over and above the Riplens, because you can put it straight on, and that really helps to improve the sensitivity of your clitoris. So back to the article. The huge advantage of vaginal estrogen is that if genitourinary syndrome of menopause symptoms are the main source of bother, you can deal with them very effectively with minimal absorption into the rest of the body. This means that the estrogen doesn't need to be counteracted with progesterone. So just to add my own comments to this again, you don't need to use any progesterone, Mirenas, Prometrium, all of that. You can just use the cream because this is not a proper HRT product. Vaginal estrogens are used every night for 2 or 3 weeks to get started, and then twice a week or sometimes 3 times for as long as having a good functioning vagina is important to you. It does take a few weeks to get the full benefits in your vulva and vagina, but in my experience, it can transform the lives of patients. Most importantly, the evidence suggests that vaginal estrogen can be continued for as long as needed. That might be forever. And just to add my own comments again, that's the truth. You can use this for as long as is required, and you might need it until the end of your days. That's fine. It's up to you. To continue on, very little is absorbed. In fact, 1 year on vaginal estrogen gives you the same amount of additional estrogen in your body as 1 day on HRT. Despite this, the package insert has dire warnings about breast cancer, endometrial cancer, and blood clot risks. For Pete's sake, as Dr. Panay said, the disclaimers are absolutely ridiculous. Please don't let them put you off. Fixing this is important for your well-being. So, and that is exactly what I have said all the way through this video. It's the single most important topic in menopause. Most women will need to treat themselves for the rest of their lives to make sure that their quality of life is good. This is a product for using on the outside of your body, around your vulva, to stop any atrophy there. This doesn't have any hormones in. This a lot of women in the group recommend. And we've come to the end of this presentation. I hope you found this interesting and informative. If you do, like and subscribe and all that usual YouTube jazz. Thank you for watching. Goodbye.